Okay, now we're going to work on Chapter 6, which is preparing injectable medications. So here are our presentation topics: intramuscular and subcutaneous injections, other units of measure, and solutions using powders. I'll let you guys read through the learning objectives. So in 6.1, the intramuscular, the subcutaneous injections, we're going to talk about calculating the volume of an injectable solution, calculating the quantity of drug in a injectable solution, and calculating ratio proportions or ratio strengths. So just kind of give you a review of things that we've already talked about in the pharmacy practice book. Is, of course, injection is a method of administering medications, of course, in which a syringe with a shaft or catheter is used to penetrate through the skin or membrane into the tissue. A few definitions, of course, is the administration of large volume of liquid medication given parenterally over a long period. And it's given usually through a needle or catheter, and usually is given in the vein. A parenteral, of course, is going to be administered by injection and not by the way of the gastrointestinal system. So there's three types: subcutaneous, intramuscular, and intravenous injections. The subcutaneous injection, of course, is going to be an injection, of course, given into the vascular fatty layer of this tissue under the skin. So these are medicines that are given subcutaneous or going to be quickly absorbed. So patients can self-administer medications such as insulin by this route. Intramuscular injection, of course, is an injection given to the aqueous muscle tissue. Meds are absorbed rapidly this way. Most time, intramuscular injections are given by a healthcare worker, but in some cases, patients can be trained to administer intramuscular injections for themselves. Intravenous infusion, of course, is the injection of a fluid into the veins. This route, of course, is used when a large amount of fluid must be administered to a patient. This right here shows you the 45-degree angle where a subcutaneous injection is given or how it is given, and it shows it going into the subcutaneous layer. When you're given a subcutaneous injection, usually they use a 25 or 26 gauge needle, 3/8 to 5/8 inch in length. No more than 1.5 milliliters should be injected into the site to avoid pressure on sensory nerves causing pain and discomfort. The intramuscular injection, if you notice the angle has changed with it. It is usually given at a 90-degree angle, and typically the needle is between 22 and 25 gauge, which is a half to 1 inch. Okay, so the volume is going to be limited to less than 3 milliliters as well. The intravenous injections are administered at a 15 to 20 degree angle. This picture shows that here as well. You see it's going into the vein. So medications, of course, given by injection are often ordered by milligram, and the pharmacy or nursing staff must select and prepare an appropriate concentration of medication from an available stock. So the calculation is similar to the method used for calculating liquid oral solutions. So we're going to use the ratio proportion to solve these problems, or you can also use the dimensional analysis method. So it isn't calculating the volume of an injectable solution is a really important job of the pharmacy staff. And we are going to use the ratio proportion method, or you can use dimensional analysis method, whichever is easiest for you to do. When a small volume, of course less than 20 milliliters, is administered, you round it to the nearest hundredth. The larger volumes are rounded toward the tenth or the whole milliliter. So here is an example. Okay, so how many milliliters? So we know we're going to have X milliliters. of medication is shown in this label must be prepared to provide 25 milligrams of medication for a patient. So you know you're going to have the X milliliters for the 25 milligram. And to complete your ratio proportion, you look over here on the vial and you know it comes in 50 milligrams per milliliter. Now remember, put the weights together, 50 milligrams. And if it just says milliliters, it means 1. So using that ratio and proportion method, of course you have the X milliliters over your 25 milligrams and 1 milliliter over 50 milligrams. So then you're just going to cross multiply. Whatever you multiply the X by always goes on the bottom. Okay, and the 25 times 1 is here, so 25 divided by 50 would be 0.5 milliliters. So calculating the quantity of drug in an injectable solution, the ratio, proportion, and dimensional analysis methods can be used, of course, to determine the amount of a drug in an injectable solution. So here is an example of the furosemide. How many milligrams? So we're trying to find X milligrams. The medication are in 6 milliliters of the solution shown in this label. So you know you're going to have X milligram over 6 milliliters. Then you're going to look in your label and how it comes stocked. There's going to be 20 milligrams and you have weights on top, so you're going to put it on top, and 2 milliliters. Okay. So using the ratio proportion, you're going to cross multiply. X times 2 is 2. Whatever you multiply the X by always goes on the bottom. 6 times 20, of course, is going to be 120. So 120 divided by 2 would be 60. So this is just a review of what the ratio strength means. Is A to A dot dot B is read A to B. Means there are A parts of a pure drug and B parts of a liquid solution. Units are generally A grams and B milliliters. And just remember, if anytime you have a percent, that percent means 100. So it could be written as 1 to 100, or the units could be, if you had to put the units on it, if it just says 1%, it would be 1 gram to 100 and 100 milliliters. So how many milliliters are needed to provide 20 milligrams of a drug if the solution available is in 1 to 500 ratio? So remember, always put what you're trying to find, X milliliters, in to provide 20 milligrams. Then you have a 1 to 500 strength. Oops, bet if you do like I did, hold on, let me erase. You put 1 to 500. Remember, 1 means grams, so I have to correct myself there the way I had written it. Grams, weights goes on the bottom, so 1 is always in grams. And then, of course, 500 milliliters. Okay, so if you try to solve that out, you want to convert, of course, using the, realizing that the, let me go back, get that off the screen. So first what I do is you want to convert, of course, you have the milliliters the same on top and you have your weights the same on the bottom. Oh, they're not the same on the bottom. You have milligrams over here and grams over here. So what you could do is, if you wanted to, an example they use in the book is they convert the 20 milligrams to grams, or to me it would be easier to put the 1 gram to milligrams, because you know 1 gram equals 1,000 milligrams. So that would be the easiest route to do, but it doesn't matter as long as they're the same. Which one you convert does not matter as long as they're the same units. Okay, it'll still work out the same. But because they give you the example of converting the 20 milligrams, if you convert it over to grams, it would be 0.02 grams. Okay, then you're going to cross multiply. 500 times 0.02 is going to be 10. X times 1 is 1. So your answer will be 10 milliliters. So next you have some problem set questions with using drug labels. If you look in your book, I think on page 151, we have some questions here. How many, and this is number 1, and I'm not going to write the question on here, but if you want to refer back to your book to see the question while I'm going over it, you can do that. Number 1, how many milliliters of solutions, we know we're needing to find X milliliters, of solution are needed to provide 50 milligrams of lidocaine. Okay, so we got that. And it says of lidocaine, so then we go to the shelf and we look at the lidocaine bottle and it comes in 10 milligrams per 1 milliliter. So if you have milligrams on the bottom, weights always go on the bottom, so it'd be 10 milligrams. And then 1 milliliter we go on top because you have liquids on the top. Cross multiply. X times 10 always goes on the bottom because it's multiplied by the X. It's 10. 50 times 1 would be 50. You can simplify by taking out the 2 zeros. 5 divided by 1 would be 5. So your answer would be 5 milliliters. Next question. This is number 2 out of your book on page 151. Okay. So it says how many milliliters, so we'll put X milliliters, of solution are needed to provide 350 milligrams, okay, of acyclovir. So we look at our label, we go to our shelves and we look at our label, and of course you have 500 milligrams in 10 milliliters. And the reason why it's 10 milliliters, so if you remember those last 2 numbers on your NDC number indicate the quantity. So if it doesn't state it very clear on the label, then you can look up there so we know it's 10. Which is very odd that it didn't have it listed on the label. But so you have 10 milliliters. So 500 milligram goes right here because you have weights on the bottom. 10 milliliters up here with the liquids. Cross multiply. X times 500 goes on the bottom, so it's 500. 10 times 350 would be 3,500. If you want to simplify it, you can take out your 2 zeros. Less numbers you have to punch in your calculator. Sometimes it helps to simplify if you have zeros, take them out, because you can sometimes do the math in your head. So 35 divided by 5 would be 7. So your answer would be 7 milliliters. Okay, next you have your calcitriol. So if you look on page 151 again, this is, I believe, number 4. How many milliliters, so it's be X milliliters of a solution are needed to provide 0.5 micrograms of calcitriol. So then we look at go to the shelf and look at our calcitriol label, and we have 1 microgram per 1 milliliter. So we have liquids on top, the 1 would go there. On the bottom, our weights would go there. So you have 1 microgram. Okay. Then you're going to cross multiply. X times 1 always goes on the bottom, so it'd be 1. 0.5 times 1 would be 0.5. Then you just work that out. 0.5 divided by 1 would be 0.5 milliliters. Okay, our next question here is number 3 off of page 151. It says how many milliliters, so it'd be X milliliters, of solution are needed to provide 80 milligrams of furosemide. Then, of course, you want to look at your furosemide label, and you have 100 milligrams per 10 milliliters. X times 100 would be 100. And it always goes on the bottom because you multiply it by X. 80 times 10 would be 800. So then you're going to simplify by taking out the 2 zeros. 8 divided by 1 would be 8. So you get 8 milliliters. Okay, next you have how many milligrams. Sorry, this is number 14 on page 152. You have X milligrams of your medication are going to be contained in 1.3 milliliters. And you go on your shelf, look at your label, and it's 2 milligrams per 2 milliliters. Cross multiply, X times 2 goes on the bottom because you multiplied it by X. 2 times 1.3 would be 2.6. Divide by 2, it should come out to be 3 milligrams. 1.3, sorry about that, 1.3 milligram. Okay, now to do one without a label, if you look on page 153, number 21. So do one without a label is, and using those 1 to 1,000 solution for this example. So how many milligrams, X milligrams, are in 2 milliliters of a 1 to 1,000 solution? So you have 1 gram. So 1 to 1,000, if it says 1 to 1,000, remember that 1 is going to be grams and the 1,000 will be milliliters. Okay, so if you notice we have our liquids the same, milliliters, and they're on the bottom. Top we have both weights, but we have 1 milligrams and 1 grams. So we want to convert your 1 gram over to milligrams, which would be 1,000. Okay, then cross multiply. X times 1,000 would be 1,000. 2 times 1,000 would be 2,000. Then you're going to simplify by taking out the zeros. At least 2 divided by 1 is 2, so your answer would be 2 milligrams. Okay, so I'll do one more example that way to kind of give you a little bit of variety. So number 22 on page 153. How many micrograms, so X micrograms, are in 1 milliliter? Of course, it said 1 to 5,000 solution, so that would be 1 gram. That's always gram. 5,000 would be milliliters. Okay, liquid's the same. We have weights, but they're different, so we need to convert the grams over to micrograms since we're trying to find micrograms. So 1 gram to micrograms would be 1 million. Okay, so 1 million times 1 goes on the top. What you multiply the X by always goes on the bottom, so it's X times 5,000 be 5,000. Again, you can simplify by taking out 3 zeros on each, because they both have 3 zeros. And then 1,000 times 5 would be 200 micrograms. Okay. So that is all we have for section 6.1. The next video I'll do will be on section 6.2.